I'm going to talk to you now about different ways of controlling your breathlessness. One way of looking at this is to think about 4 Fs. The first F is to lean slightly forward. This will allow the diaphragm to relax and makes breathing a little easier. The second F is to flop the shoulders. Quite often when people get breathless, they get very tense in the shoulder area, and flopping forward is a really good way to control this. If you can flop your shoulders forward and then lean forward. The third F is using a fan. You can obtain a fan from the Interstitial Lung Disease Service, or you can buy them quite cheaply online. What you need to do with the fan is to hold it approximately 5 to 6 inches from the face, blowing over the mouth, and also in 3 areas around the side of the eye, the side of the nose and the side of the mouth. This will activate the trigeminal nerve, which will make the body feel that there's more air coming in. This can be very helpful in reducing breathlessness. It's a really good idea to keep your fan in your pocket so you can take it out whenever you need to, if you're outside going up an incline or if you're climbing stairs. If you could turn the fan on at the side, hold it 5 to 6 inches from your face, blowing up over your mouth and nose and then moving around to the side of your face. This will naturally help breathing slow right down. The fourth F is to focus on your breathing. This is really important for controlling breathlessness. What you need to do is to breathe out much longer than you're breathing in. So you can do this in different ways. You can breathe in for 4 seconds and breathe out for 6 seconds, and this will naturally slow your breathing down. The other thing you can do is to pick a rectangular object that you can see in your room, for example, a picture or a television, and when you're looking along the shorter line of that rectangle, you breathe in, and when you're looking at the longer line of that rectangle of the picture or the television, you're breathing out. So this will really help you to slow your breathing right down. You breathe in and then you breathe out a lot longer, and this should really help you with your breathlessness. And I'd like you to focus on your breathing, and what you need to do is to slow down your breathing out. So pick a rectangle that you can see, a picture or a television, and breathe in along the shortest aspect of that rectangle and breathe out much slower along that longer aspect of that rectangle. It can be helpful to purse your lips a little bit when you're doing this to slow things right down. Something else people sometimes use is what's called the 4-6 breathing technique. You breathe in for 4 seconds and you breathe out over 6 seconds. You're really concentrating on slowing your breathing right down.